Okay, so let's start now. So this is the July meeting of the Jaffna Club. So welcome to this. So as usual, I'll introduce or who are joining for the first time or people who are watching the recording. So our objective, the club will facilitate, foster and support social intercourse and fellowship amongst its members. It will build a network of members and non-members that can work together to promote the economic development of the Northern Province. Today's agenda, so my welcome address. Our speaker today is Professor Dean of Faculty of Medicine, Jaffna University. I've known Suren for many years. I've seen many projects that he's been working on. He was head of community medicine. He's been at Mulai Hospital and at Green Memorial. Very complex guy. Today he's going to talk about the opportunity for medical tourism. After Suren's presentation, I will spend time on Jaffna Club business. So what is the club for? The club's a catalyst to help people like us connect with each other, help people like us connect with Northern entrepreneurs and business owners. So I say the club is a catalyst because I've always felt the club should be building itself up into a big empire and start businesses and stuff like that. The catalyst is to help other people their own projects and support them as they grow. Since our first meeting in September 2020, we've had 27 different speakers. So these have been senior partners, proprietors, proprietor Janan in New York, Bimal, Raj Gopal in California. We see Jay Yanam, who has invested in tourism and so one of the coaches. Jaffna Kumar, who I need to face with, he's also new projects. Young entrepreneurs. Governor spoke to us a few months ago. We had Professor Alex Baraj, who was on education. And we've had a very interesting talk by Nuparaj on aquaculture opportunities. Today's speaker is Professor R.Surenthirakumaran. So, Suren, if you want to take a share of the screen, I will.
There's some noise coming, Jagan, like a bird.
Yeah. Someone has a bird. I must say it's very nice, but can you please mute yourself? Okay, bird has gone. Suren, can you take over the share?
Yeah, thank you so much, Jagan, for your kind introduction. I'm great pleasure and honor to 7:48 or 8:30. Honored to have a kind of this presentation here in this audience. So it's for me also it's a learning topic. It's not my favorite one, but that I think that I try my best to convince the audience that then I'm able to present. Yeah. So what we are trying to do, some of the projects here in Jaffna, and also that opportunities what we have as a kind of community which has a lot of international community support, whether we can develop this medical tourism. So this is my aim today to present these with these economic experts and the business and also academics here. I hope that you all can see my slides. Is it clear? Audible and my thing, and also slides.
Yes.
Yeah, great. Thank you. Medical tourism in Jaffna. This topic as given by Jagan for my today topic. So after that, then I try my best to search for some of the things. So I want to see this, what are the reason that people are going for the medical tourism and the global trend, potential benefit for Sri Lanka, then how we can make Jaffna as a global destination for medical tourism. And I try to explain one of these possible projects that could be launched immediately. So these these last couple of decades, the medical tourism has been increasing and then making that quite impact on this global economy. There are several reasons that for the people to embark on this medical tourism. One of the thing is because of that low cost care, and then the people look for good quality of care. This was the case earlier days. Then people from developed countries, they go to developing countries, they go to the developed country to get a high quality health care. Then people go to either UK or US. So particularly that many people go to US to get that care, the medical care. But that now things have changed. A lot of people from developed countries, they are looking for care because of this cost thing. And then there are insurance issues. Then some of the procedures are not covered by the insurance. And then the long waiting time. So then to cut down that, then also the people want to move to some of the developing countries to get services. And then this is a part of this enjoying vacation is another thing. And also there they can include some of the local therapies, then particularly some of the traditional Siddha or Ayurvedic kind of a treatment. Those are the main reason that people embark this medical tourism. So very difficult to define the term medical tourism. So that's why that very difficult also the amount of wealth that is created by the tourism is also very difficult to estimate. Some of the definitions that people use for the research purpose, sometimes it's narrow, or sometimes only consider the medical one only, and broader ones usually cover the medical and wellness tourism. So the Global Wellness Institute and categorize this medical tourism and the wellness tourism. So the medical tourism travel to receive treatment for a diagnosed disease or ailment or condition or to seek enhancement. And other one is well-being, that to, you know, there's improve health and well-being. So most of the time, the desired for lower cost of care and then high quality. So then people look for this high quality, affordable cost of care, and then the access of care also played a role. So then, but the other group actually motivated to have a kind of a healthy living, disease prevention, stress reduction, and those kind of things, and the lifestyle habit, and people go for kind of a wellness tourism. So, and then when you look at these medical tourism, that global medical tourism market, actually they said is it's growing fast. So they estimated in 2021, it is almost $14 billion to 53 billion in 2028. And then they forecast these annual growth of 21.1%. So, and also then people observe this impact of COVID-19 has been unprecedented and staggering, but that market is catching up in post-pandemic period, and again started to grow. So as I mentioned earlier days, people from less developed countries travel to developed countries for treatment, which either unavailable or was not developed adequately. But things have changed, and then a lot of people from developed world have started medical tourism to the developing countries for many reasons. So when you look at these globally, what sort of countries are really making use of it, and so India, Thailand, Singapore, Dubai, Abu Dhabi, these are the countries, and particularly in Dubai, Abu Dhabi, that recently they have started, and they have introduced several different packages to attract these people coming from developed countries into the tourism. The popular areas, when you look at that for the tourism, is cosmetic surgery, dentistry, organ transplant, cardiac and orthopedic surgery, reproductive tourism, and traditional and alternate tourism, wellness tourism, Ayurvedic treatment methods, and for this concept of healthy lifestyle. So, so these are the main areas. Most of the people they undertake this medical tourism. So whether Sri Lanka is suitable for the medical tourism, when we look at the Sri Lankan health service, it's considered as one of the low cost and high efficient healthcare, and also received many international and global recognitions and awards, particularly in maternal and child health and primary care. And also this healthcare at a tertiary care level, or maybe that in the secondary care level, the quality of care has been increased over the year. And then it helped this our population to achieve high level of life expectancy, and then all kind of high quality, sophisticated instruments and technologies. So the latest technologies are available. And also that we got this very good national network of blood bank service to support particularly for these surgeries, and also even for the other care. So one of the reasons that we are able to reduce this maternal mortality in the country, and then got these very good indicators in the region. And then nowadays that we have a very good postgraduate program, and then also these our postgraduate trainees, they get this training in foreign countries, especially they go to UK or US or Australia as part of their postgraduate training, and they are very good, and they are familiar with these modern technologies and techniques. So then most of the things are now adapted in the care of things in the hospital, and also most of the private hospitals in Colombo and things are getting these kind of facilities. And then and so these some of the private hospitals in Colombo really they worked out and to get into this global market, and they were able to get this kind of accreditation, Joint Commission International accreditation. They were able to get it. There are still many gray areas to be addressed when you want to have a kind of a successful medical tourism in Sri Lanka. There are problems with these law, particularly for litigation, but that even for the visa, there's no kind of a clear laws for this medical tourism. So there are a lot of things need to be addressed at higher level to facilitate. And also there's no kind of a coordination or that mechanism or avenues to facilitating the patient insurance system, their on country insurance system to pay to the patients coming over here and to get that. So that is another international kind of a work agreement, and things need to be looked at. And also the medical records, still we don't have a kind of a world standard electronic medical records that which should allow access the facility and where the patients coming from the host countries. So that also we have a problem. And then providing diagnosis card which could be acceptable for the host country. And then also even before coming here, then patients, they can have a kind of a telemedicine service, have a kind of a discussion and get ready. And then even after the getting the service also, then when they go back and to get then kind of a follow-up also, and there are things that need to be addressed. And then some facilities, that for the relatives when they are coming here. And some of the countries, they have a kind of designated apartments to provide that when the people coming for the medical tourism to have a stay, and then having packages to support the relatives and other people. And also there is no actually proper way to assess the success rate, whether our healthcare service really has the ability to provide then required or needed quality of care is still not available. So Jaffna as a place of medical tourism is another thing, and we can think about, because mainly we can think about to 1.2 million Sri Lankan Tamils living in various parts of the world, and that is also almost equal or more than the Tamil people living in northern province. With this Jaffna may attract this group of people because already they lived here, and then they know, and then they maybe prefer to have their things in their ancestor or this hometown, or maybe this the place which is culturally familiar. So that may be the opportunity for maybe next 10-15 years for us to think about. And also Jaffna, when we look at these several other industry, Jaffna, this medical service industry, and there are few good successful private institutions, and then medical services have been improved, particularly in the post-conflict period. And now we have many specialists, and with these specialities, even transplant surgeon, cardiac surgeon, neurosurgeon, urosurgeon, and all that thing. But that we are not really utilizing their specialty and their ability to provide good quality and world standard, and with this international recognition. Because this existing government system and the government health facility is not able to provide. Still, Ministry of Health is struggling to develop a full-fledged transplant surgical facilities. So we need to think about then how we can develop something like a public-private partnership to put up more and more this kind of centers and make use these specialities. Then in Jaffna Hospital, teaching hospital alone, now we got 105 such specialists working. So then there's a kind of so then whole Jaffna northern province, and we got around 200 specialists, and so then we could able to make use their skills and ability to develop the economy. So it can be offered in all the government or private sector. That's particularly in the tertiary center like teaching hospital, and the Faculty of Medicine, the University of Jaffna, and University Jaffna alone, the Faculty of Medicine alone got these around 25 specialists. So then there are more specialists can join, and there are various things like we can introduce as a public-private partnership, and also the private hospitals. We are the community we pioneered this Western medical service in South Asia, that first Western medical. So Green Memorial Hospital in Sri Lanka, and then Cooperative Hospital in South Asia, the Cooperative Hospital Mulai. So those are the places, and we may be able to use to develop this kind of services. So when you look at this Cooperative Hospital Mulai, one of the places where we can think about, and which is the one I am associated more than 19 years, and we try to develop that because this hospital was running very successful in 1949, which got these 59 staff, including 3 doctors and 8 apothecaries. So when we consider that level of care in that time, so this was a wonderful achievement. So even 1970, it had 122 paid staff, but unfortunately, because of this war, the 5-acre vicinity, and it has ample opportunity to expand more in the surrounding areas, and a good climate, and also there are very other supportive environment that with seaside, sea breeze, and developing kind of recreational tourism plus medical tourism. So So that is one of the things that will bring a lot of avenues that economical development for our community, that not only for the medical service but also for other kind of thing, like people will come and stay and consume. So then we can get this flourish now. Then transport industry, hotel industry, and then farming, and then fishing, and there's a lot of these avenues, and we could able to develop when we can develop this kind of a thing. So now the hospital actually developed with the support of many diaspora organizations from UK, USA, Canada, Australia. So, and also some of the financial support from British, Dutch, US government, and also from state. So the hospital now is able to provide some cardiology, eye, dental, diabetes, pediatric and maternal clinic, and also then some kind of a operation theater and the ambulance service. So these are the things, and what is happening at, I want to share this, some of these income, and then how the hospital is performing. The hospital is now making kind of a that annual turnover of 200 more than 200 million of Sri Lankan rupees, and also it has a kind of a growing in nature. So and also this recently we have opened up kind of a joint clinic in the main street of Jaffna town. So now that has mainly that focusing in the fertility. So it has increased the growth of this, and you can see in this slide how things are performing, and also that the pharmacy sale also then has increased over the months. So this January figures, and after that also the things are improving, so we can share that more. So we considering this, the hospital is also introduced a project called Thaime. So I am as part of this medical tourism as one of the example. I want to share that how that could be converted as kind of one of the successful example to think about or maybe get into these other areas. So we know this globally, the fertility and reproductive health services, and as I mentioned in my earlier slide, it's a great need. So it's a global demand, but that especially this issue is more, and sometimes it's maybe exacerbated because of our some of these cultural and other kind of practices. So we wanted to develop this as a kind of a community project, but which also could develop some profit, and that profit could be utilized also for the benefit of the couples then coming from with this poor or so poor economic or lower socio-economic strata. So there is a video clip. I don't want to think, and I can share this slide, and later on you can watch about this our project time. So it's in Tamil, but that we are in the process of making it in English. So this is place where we want to develop these services. So then what we have achieved so far, we have developed infrastructure which is needed for the center. And then Dr. Jayantran from US, and he helped us to develop kind of a anthropological services. So then now that services have developed, and then we got some sort of support for the IVF equipments, but we need more equipments for the embryology lab. So, and also we started to train needed technical personnel like embryologists, anthropologists, and nurses, and all sort of supportive staff. So the cost estimation of the equipment needed is about for the phase 1, it's about 73 million. So already we got this from Chicago, that's Dr. Jayantran, it's 24 million, which is worth of 70,000 USD. And also we got some things that like Temple, Nagpusani, and we are also negotiating some of the local donors. So we generate some of these 6,000 to 7,000 USD. But that we need to do that more 47 Sri Lankan rupees, which is coming around 136 USD to get the equipment. So I hope that can you see the equipment list? So these are the equipment list that we need to purchase for this implementation of this project. So then details, I don't want to go through this detail.
No. More I was because it has a history. I don't need
And then now we are looking for now somebody that who can give us a loan, so we can pay back in 4 years or 6 years. It depends on the request. So once pay off all the loan money, then we could make it 60% of the profit, which should be allocated for the patients or who need financial assistance. On the other hand, if we can get kind of a donation, and then we could able to do it financially. So we have done the financial forecast and how we can recover. So then this is our financial forecast that for 4 years, and then we are paying that 15% interest rate, so we could able to pay back. So when we get 6 patients per month, that's what we anticipated, and with this present cost structure, and then repayment and forecast for 6 years. 6 years also we have done. So I'm sorry. Can you see my slides?
Yeah.
So then, so the potential benefit for medical tourism, at the moment, we don't have a kind of a full-fledged services, but that we receive at least 5 to 6 diaspora couples coming per month, and visit to our Main Street Clinic Center, and then we send them to Colombo to get the treatment. But that if you can get then proper center, this number could be more. So then but they are coming for various reasons. So because one of the things that very extensive at their present country, and also then there are other services whether they can get simply here. So because of that reason, then most of the people are coming here to get the treatment. So we are getting people coming from Europe, Australia, Canada. And also this will also provide the opportunity for the family members to come with them and also stay for a year. And also they can get into some other services, medical services, wellness service, and also the other benefits. So that will bring all together to the northern province. And also, as I indicated earlier, so it also will help to develop the non-health sector section also. So sometimes that people may worry, that present situation, and also we don't know this future, but then I always optimistic and see, then whether is it possible and taking chances, maybe trying these things. Sometimes it may be fun, but we may make mistakes. I hope that we can learn a lot of things from it. This is what I want to present you today, and then I am very happy to part of discussion and also ready answer this. Thank you again for listening and then all joining today. Some of the people for this morning, some of the people for this is afternoon and the evening. So